Hi, everyone. I hope you all have been enjoying this really fantastic conference that we've had. My name is Ken Sutha. I use he, him pronouns. I am a pediatric nephrologist here at Stanford and co-chair of SMATI along with Dr. Poulos. In addition to taking care of kids with kidney disease, I also have kidney disease myself, living with it since I was about 10, having gone through 2 kidney transplants and spending 2 years on dialysis during my fellowship training here at Stanford. Even though right now the impact of my kidney disease and disability from it is at a minimum, I have learned how being a part of the disability community and embracing that disability identity really brings strength and power to my experience and my ability to work with others. As a description, I am an Asian American male. I'm bald. I'm wearing a dark blue short sleeve button down. I have flowers from the Lucile Packard Children's Hospital courtyard in my background. Before we get started, I wanted to take a quick moment to acknowledge some comments that we saw on the Slido during our last session before the breakouts. We understand that it's upsetting to hear that the Neurodiversity Project received funding from many sources, including Autism Speaks. I'd like to take the opportunity to tie this to some comments during the bioethics sessions with Drs. Holly Tabor and Kevin Mintz. Dr. Mintz shared that one of his constant frustrations as a trainee was wanting to fix everything while seeing harms and problematic histories throughout the institution and realizing many things were outside his control to fix and fix immediately. Throughout healthcare, we've found many histories of harm, from the Tuskegee syphilis experiments to the barriers that many patients face in accessing healthcare. To do good work, we need to engage with these histories. We need to learn from them, and we need to find ways to do better as we move forward. And because these are not one and done fixes, we need people holding us accountable. So we thank you, Dr. Fung, for your encouragement to engage in public learning and forgiveness. And we thank the commenters who remind us that harm done should not be ignored. To call back to Dr. Chase Anderson's discussion of DBT, it can be healthy and healing to hold multiple perspectives at the same time. And because disability itself encompasses so many diverse experiences, this is a great venue to practice. And so I think that's a great segue into our session. It's my great honor to reintroduce the speakers that we had from our previous sessions. First, we have Dr. Sarah Victor from the mental health session. Next, we have student Dr. Amy Bagwadia from the ethics session. We also have Dr. Chase Anderson from the social media session. Dr. Laura Bulk from the interactive theater and disclosure session, and Dr. Lawrence Fung from the neurodiversity session. To kick things off, we'll just go in order of the way that the session started. We'll start with, I'll ask all of you to answer this first question, starting with Dr. Victor. What did you learn from today, and what were your big take-home points?
Oh, I have to start. So many different things. I think really what this set of presentations highlighted for me is just the diversity of experiences within this sort of umbrella, and all of these sort of intersecting concerns and considerations and approaches and experiences, and trying to think really critically about the ways that my experience informs my thoughts about disability, but obviously cannot be the only way that I think about disability, and making sure that I'm not using my own experience to kind of say that must apply to everybody else. I think that's my sort of where my brain has been at today.
Yeah, thank you so much. Hi, everyone. Great to see you all, and thank you so much for your active participation today. I'm certainly learning a lot, but if I just had to narrow it down, I think to one thing, it's this idea of community care being a labor of love. I think I unexpectedly found myself tearing up at so many different places that I didn't expect to throughout the day, and I think that as folks have put in the Slido and in our lovely Google sheet as well, just so many resources and opportunities to say, hey, I'd love to connect. hey, me too, hey, you're not alone. And I think that that is so powerful. Oftentimes, I think we think advocacy is this big, grand, like, let me go to DC and Capitol Hill and like pass a bill. And like, yeah, that is a form of advocacy, but so is just being here today. So is speaking here today. So is even just direct messaging one person saying, hey, this meant so much to me. And so as a medical student, I'm so heartened and excited to be joining one day amongst all of you as colleagues, and to continue learning and growing in this community of care and compassion.
Great. Chase?
I would like to echo my other panelists that I'm getting to be with today. I love all the comments so far. And also, I'm now wearing a gold top with glitter, just so everybody knows it has changed from the blue shirt with white flowers. So I think the thing that I really took away from today was the power of self-disclosure. I think it's something that we think about and talk about. I think we got to see people do that in action today. A lot of the panelists, like everybody comes in with their own story. And sometimes it's hard to share. Sometimes it feels scary to share. Sometimes it's not safe to share. But everybody on the panels today opened up about some pretty big things that have been parts of their lives. And I think that's really, there is beauty and power in vulnerability. And I really appreciate everybody doing that today. And that applies to everybody who is not on the panel, but who is here listening. A lot of you shared your own intimate details of what your life has been like. So I just want to also say thank you, because that also takes a lot of courage and bravery, and it's very beautiful for us as panelists to be part of that too.
Laura?
All right. Well, I will echo and say that I concur with so much of what has been said. It's difficult to choose one or two or three or 10 things. I think these themes of community, right from the first of the conferences, we got a bit of the history lesson this morning, until now, like this is a community. And to what Chase, what you were saying about that vulnerability, I really appreciate that. There is so much power in that, and the courage as well that it takes to come to this session. For some folks, that took courage, and so we really I'm so appreciative of that, and of for me, that I'm still learning. I've been very privileged to be involved in this world for like a decade or something, but I still learn so much every time I get to interact with folks, and it speaks also, Dr. Victor, to what you said about learning from all these different experiences, and with all the intersectionalities that each of us brings. It's really powerful. So thank you all very much.
Dr. Fung?
It's quite a privilege to be able to hear so many perspectives today. Unfortunately, I was a little bit late. I flew back from Ohio this morning, so I missed some of the sessions, but for the ones that I have seen, I really see a lot of the courage that, just like all of the other panelists are mentioning, that because of the courage of talking about some of the things that are uncomfortable, we learn. And really, I learn every day. I got that same question about Autism Speaks several times before, and I'm still learning how to really figure out how to address to everyone's needs. There are some really painful things that some people really experience, and that really take the place of almost anything else that's good that's happening. And that's actually very, very unfortunate. So how can we actually reconcile and figure out ways that can be constructive, and walking together, always thinking about constructing and building and making us stronger together. because if we are here all together, is because we have a same mission, and the same mission is to get us all stronger.
Definitely. Thank you so much. I think it is a difficult thing to wrestle with when we are all inherently are embedded within within institutions that cause harm, but we still are privileged to benefit from them. And so I think that these are important questions to continue to ask ourselves and to continue to wrestle with. On to the next thing, just thinking about the conference as a whole, what are you most excited about from today, and themes that you saw between the different talks and the different sessions that may have come out?
I can jump in if you'd like. So one of the themes, it feels like it's just a life theme for me, is the power of relationships, and the power of community and belonging. The belonging, I see it everywhere. And so I think that's something that I noticed in various sessions, is the power of having community, or just relationship of some kind, in a way that works well for you, and that helps you move forward in the way that you want to, and to be able to move towards whatever your success means. And so I think that is a beautiful piece of our shared humanity, that we need relationship, we need interdependence, and that's something we learn from disability wisdom, from Indigenous ways of knowing. This is really important, that we are interdependent and connect with one another. And thinking about disclosure as a theme that we were thinking about a lot in preparing for this, and that I think about a lot in my life, is that relationship piece. I guess one of the things I'm thinking about is, I'm excited there have been so many people here. I'm really hoping there are people here for whom some of this was like brand new, and who will be those recipients of disclosure. And well, all of us are recipients of disclosure, to tell you the truth. But yeah, for whom this was like, okay, like a great opportunity to be introduced to some of these ideas, because there is such a large audience. Perhaps we're making ripples in that pond, and there will be more people for us to engage with in relationship in a good way. So again, Haichika, thank you. I raise my hands to you for being here today.
Thank you so much. Anybody else?
Yeah, I'm happy to jump off of what Laura so beautifully shared. I've been thinking a lot about disclosure and how that relates to, Laura, I'm thinking of the one particular scene at the very beginning, during the live theater, when there was the student and the professor was like, I care so much about you, and was being so nice, but still ableist. And I think that something for me, as someone who lives with multiple chronic illnesses, is like hard sometimes to still try to like stand up for myself. And it's been 14 plus years of being chronically ill, but it's sort of like a learning process. Like, what does that look like through different stages of training? And I love, especially during that particular session, the interaction of so many people in the comments saying, hey, no, stand up for yourself. Like, it wasn't okay. Like, yes, the professor seemed nice, but you don't have to accept that. And I think that was so beautiful, the way that the community was kind of calling out and coming together. And I hope that we're each able to take those learnings as we go forth into our own communities outside of this conference, when we are recipients of disclosures, when we are bystanders. Can we be an upstander in that process? And I think that's something I've really been reflecting on, and hope that we all can kind of think about situations more critically, and recognizing that if it's the first time someone's disclosed, or if it's the 100th, it's still a really scary thing. And so the power of patience and listening and allowing folks to share their journey authentically, but also share as much as they feel safe sharing. And I think that that's the other really important piece of today. No one should feel that they have to disclose, or they have to, oh, you should have told me, right? But it's your own journey, it's your own story and narrative. And I love the theme today of taking back your narrative and of us gently receiving that in the process.
I can
Yeah.
jump. I
Go ahead,
think
Chase.
echoing Lauren, Amy, and what was beautifully said. I think Amy really touched on what I was thinking about in terms of authenticity. That's something that I really saw today with not only the panels, but comments and things like that. And I sometimes don't think we all recognize how much like beauty and grace there is in authenticity of showing up as yourself and feeling comfortable showing up as yourself, and what it means for people to be able to show up as themselves, and how that helps mental health, how that helps us become better people. So I really think everybody modeled that today in a really awesome way. The other thing that really stood out as well, and what I hope we take away from here, is the need for self-compassion. People are hard on themselves. People already are dealing with enough, and then they internalize things that other people say. We've seen this across America in many different ways, especially for minoritized groups and different minoritized people. And the country's scary right now in a lot of ways. So it is okay to be gentle with ourselves as we do this work and as we try to live authentically, because we're all here together and we're trying to be better than our previous selves.
I love those ideas of thinking and talking about some of the benefits of disclosure that aren't like a tangible accommodation or something like that. You know, I think a lot of times when I'm having conversations with folks about disclosure, we're really focused on risks, and we lose some of these more kind of less tangible opportunities for connection and for like the emotional benefit of not having to walk around concealing an important aspect of yourself, which we know from psychological research, it has a cost, it has a burden. So I just really appreciate being able to kind of reflect on some of those benefits of community building and authenticity and self-compassion.
Yeah, I really echo what all of you have been saying, and especially what Amy was talking about, the need for the safety in order to disclose and not to have any pressure on disclosing. And if it's the right moment, and maybe that's the right thing to do. And having the discussion on disclosure is really important starting point, and hopefully there will be some methodologies that can be helping people to think about disclosure more generally, and that may be very complex because everyone's situation is so different, but that can be helping a lot of people if there's more guidance and more people are willing to walk together with the people that are feeling vulnerable.
Yeah, thank you everyone for your insights. Disclosure is an evergreen topic that, you know, I think as much as I talk about it every time, I feel like I learn something new and different perspectives. There's no one size fits all to it, and I think that learning that different people have to navigate things differently for themselves and figure out what's right for them is important. And with that comes like that sense of cultural humility and understanding that other people are going to do things, they may see things differently for themselves than you see things for yourself. And I think that's a super important thing that I think has come out through today. Before we get to the Q&A, one more thing to kind of address. Are there any action items that you take away from today, and thoughts about how we can bring those forward and sustain the excitement from this conference into future work?
I can kick us off for this one. I think giving yourself the takeaways that I would have from here are giving yourself time for self-reflection of who you are, the various identities that you hold, and how you want those identities to like weave with each other, how they clash in different ways, how they like you want them to come together, and how you want to move in society. I think this goes back to also like what is safe for you and how you want to move in society, but letting yourself dream about how could I move in society if society really supported who I was, because that's what we're working towards in a lot of ways, is a society where people are seen and validated as themselves and get to be those kind people that are underneath all of us who just want a happier life. So I think that's what I would say is our takeaway or my takeaway from today.
Yeah, Chase, thinking about what you just said, that one of the things that was rolling around in my mind and has a lot is like one day perhaps it will be that to talk about the disabled parts of myself will be comparable to talking about other aspects of one's identity and who one is and what one does, and it won't be like, oh, like I really have to analyze whether I can disclose and how much and how often. Yeah, so maybe one day. I think thinking about action items, one of the things that first came to mind in the very first session this morning and kind of I've been thinking about is perhaps something that I can do in my daily life and interactions is to practice even more curiosity than I do now, and gentle curiosity, but just to learn from other people, like, oh, like, how do you do that? How do you think about that? And that might open opportunity to say, oh, I do that differently, and to share a little bit about that. And that idea was sparked, I think, was Adam was talking about just doing things a bit differently, and different people do things differently for a wide variety of reasons, and that's part of the beauty of humanity. And so I think this curiosity, this curious practice can help to make those connections in our shared humanity. And then another way I think we can make connections in our shared humanity is to acknowledge, well, at least I will choose to acknowledge I will mess up. I did probably today, at least once. And I will say something that's ableist, or I will say something that's racist, etc. And I hope that others will call me in to something better. And then I will also be able to call them into something better when we're in relationship with one another. But I think that starting from that place of humility can break down some of those barriers.
Laura, I had a very similar takeaway sort of from the first session as well as the second when we think about ethics. I know Dr. Tabor, there was a question I had asked both Dr. Tabor and Dr. Mintz about, well, you know, these are lovely, important textbook cases of ethics, but how do we actually apply this like into daily practice? And one of the things that Dr. Tabor said was, well, you know, you look at a situation, you think about a clinical encounter, and whether or not disability is explicitly mentioned, just take a step back and think, okay, so what is my reaction to this? And like, why is that my reaction? What are the intersecting identities, both of myself, like as a clinician or as a medical student? How can my own positionality influence the way I'm viewing this situation? But then how do the actual folks within the situation, whether it's other folks on the care team or whether it's the patient themselves, how do their identities also sort of intersect and impact the way that they show up, as Chase is saying, and the way that they are also perceived? And so I think this idea of gentle, persistent curiosity is so important. And Laura, from your session, the idea of patience, right? Like, yes, we have to get everything done, but also let's have patience, let's have grace, because that oftentimes can like calm situations down, make folks a lot more safe, and feel able to show up as their true authentic selves, which is, I think, a world we're hopefully all striving towards, slowly but surely all together.
Yeah, definitely. Great takeaways from everyone. Okay, let's see if I see anything in the chat. From the Slido, one action item could include forming groups of those with similar experiences to help lead change. And as we heard from several of your presentations, kind of the importance of community and finding other people with these shared experiences has really helped to drive you forward. That does kind of bring to mind one of the things that you brought up, Dr. Victor, related to the perceptions around research, and kind of when you are working in a space in which you are also intimately involved personally through your own experiences. Could you comment a little bit more about that? And I see Laura, maybe we'll have a follow-up to that as well.
Yeah, so our research that we've been doing with psychology faculty and trainees suggests that there is, in fact, a pretty significant set of biases towards folks who do what we've been trying to sort of more scientifically call self-relevant research, but most people call me search. Particularly around mental health conditions. So for instance, if you ask folks how biased is a researcher who's had cancer going to be if they want to study cancer, those ratings are lower than if you say how biased is someone with a history of depression going to be if they want to study depression. And so what we've really kind of tried to advocate for is the recognition that all humans have biases. All humans have a unique perspective that's shaped by their experiences, their identities, and the experiences and identities that they do not have or have not had. And so rather than solely being concerned about, is this person, because of this experience, going to be biased or not objective, to think about that for all researchers, all clinicians. I think this goes to what Amy said about taking that step back, which goes back to what Chase said earlier, thinking about, why am I responding in this way? What might be impacting my responses? One way or another, and then acknowledging that in the work that we do, that all of science has these kind of decision points, and the way that scientists can and do shape the work we do. I know psychology, we've tried really hard to be as objective as possible, and humans are still humans, right? So I think that would be my thoughts on that for sure.
Laura, it looked like you had a comment.
Yeah, I'll build a bit on that as well. I think so. I've done a bit of work around thinking about research or insider research and the power that has. And I think the overwhelming things that I've found is that actually there's a lot of power in it. It's more of an advantage often than it is a disadvantage. And I think it's important to remember, no, I'm not a complete insider to any other person's experience, because we are not just one thing. And I think something that has stood out to me is the importance of building that solidarity. So Ken, you were reading out from the Slido and thinking about making groups around shared experience. And I have had sometimes when my experience is really closely aligned and shared with one of my Indigenous friends, and I'm a white settler and she doesn't have a disability and I do, and but based on my disability experience and my experience as someone from a first generation university student and different things like that, where we had this incredible shared experience across different identities. And so I think there's a lot of opportunity in that for that solidarity across experiences, and for us to build on that as well.
Oh, yes, definitely. Not only is disability a fundamental part of diversity, disability itself is so diverse, and our experiences, even with the same condition, like my experience being on dialysis is completely different from somebody else's because, you know, maybe they have children they have to take care of, they have transportation issues. I have so many privileges that I bring to it that are going to impact that the way that I view it. And it's interesting how narratives around like self-directed kind of research can be different. Like exactly like you mentioned, Dr. Victor, kind of the impact that people have around cancer research, or there's a fellow who does research on his like very rare genetic metabolic disease that gets really celebrated. But then when more stigmatized conditions are being examined, there's this difference. Dr. Anderson, Dr. Fung, Amy, do you have any other thoughts on this?
I think someone had put in the slide out earlier about, you know, is it increasing bias or is it increasing relevance, right? And I love this idea of, you know, it calls back to nothing about us without us. And what does that actually mean in practice? And I myself decided to go into medicine because of my own lived experiences with various chronic illnesses. And every time, you know, I show up in that, you know, practice clinical encounter and I put on the white coat, I'm like, oh, it's like weird being on this side of it. But I'm also so grateful and privileged to be, because that means that I'm entering the space, hopefully with extra empathy and compassion. And so then when I eventually look a patient in the eye and say, well, like, you know, it is going to be a tough road, but I'm here for you, it has a different depth of meaning. And so that's how I view sort of the clinical piece of it. But then when it comes to research too, this idea of like community-based participatory research. I'm currently designing a study for kiddos with my same like chronic disease, and I just presented it to the grant committee here at Stanford, and it was really exciting to say, yeah, it's community-based participatory research from design to execution, including the fact that I myself am part of this community. And I think that that is like a really powerful, exciting thing that I think should be celebrated more when it comes to increasing diversity and inclusion within medicine. And that means increasing representation of people who do have experiences with disability, lived experience, and recognizing too, my experiences are vastly different from every other person's. And so how we show up in spaces, how we serve other people matters. And so I think that to all the trainees, particularly out there who are trying to do research and increase representation, it's a hard road, but it's worth it and it's exciting. And I'm excited about sort of folks being able to use their positionality in a way that gives back to the community that they came from.
Yeah.
I'm just gonna jump in and say they might call it bias, but I call it crip wisdom. Like what you're doing, they'll be like, oh yeah, you're biased. No, like you're bringing a unique epistemology and a unique wisdom to what you're doing. Good for you.
I think from my standpoint, I agree with everything that's been said. It's also about trust. We trust somebody who has a rare genetic disorder to do research on that genetic disorder. Why are we not trusting somebody who lives with depression, somebody who lives with like a disability to actually do the research and do it properly? That person has gone through extensive years of training and also understands their illness in a way that other people who are not doing that research or do not live with that experience don't. So why are we not seeing that as a really powerful thing or like something that should be utilized or respected? Why do we view that as this is an issue, like, and so we can't really like take their research as credible, instead of saying like this is actually in so many ways so credible and really furthers the field because it is, like Amy said, like by us and by the people who actually have lived this, and so they are trying to study it to help other people. So why don't we view it that way a little bit? So I think we need a reframe of the stigma that we're doing or enacting right now.
I think a lot of times part of the challenge is that the folks who have those lived experiences are also wanting to do the work or, have those messages that don't necessarily sort of toe the line of what the kind of broader set of scholarship says. And sometimes that can be hard for folks to hear. And so, sometimes I'm in the position of being a little bit of a rabble rouser. Like I do a lot of training of graduate students, and particularly around diagnosis and assessment. And we start our course going through a lot of the history of why the DSM is biased and does not kind of fit with, how different cultures and people of different backgrounds conceptualize their experiences. What is mental illness, and so that can sometimes be seen as sort of challenging some of the status quo. And so it's easier to say, well, this person is biased because of their lived experiences versus trying to maybe argue with me on the actual kind of solid foundations of scholarship, I think.
Dr. Fung?
Yeah, I was going to go back to the stigma part of the discussion with the invisible disabilities. I actually would usually want to just call them neurodiverse conditions, because in the community that I work with, they don't want to use the word disability, because a lot of them, their characteristics of their condition gives them streams. So when you give them the label of calling it actually a problem, then how can the problem be also streams? So so that's why in terms of the terminology, we are trying to move away from the disability kind of nomenclature, and trying to describe what the person can do and what are some of the challenges. And the stigma for the people with neurodiverse conditions can be quite different from the physical conditions. And it's because of various different things that may be involved. For example, someone has the condition, physical condition, and has already recovered completely, then the person is completely healthy, would understand how a person that has the illness can feel like. But with neurodiverse conditions, practically they live with their condition throughout their life. It's not going away, and it's part of their identity, and it's part of what they want sometimes. So that would make things very hard for them to think about like needing to use a medical model. They would really think that they don't want to be fixed. So all of that can make things harder if they have been traumatized. And if they have been traumatized by exactly their condition, because of people calling them names related to the condition, and all of those would make them not want to disclose. And they may not want to disclose even more when the environment is not understanding. It's not understanding that they can be very, very strong. They can contribute to the team a lot. They may be having social interactions that are different from others, but they can still contribute tremendously. But a lot of people don't understand autism, for example, or this person's autism. Everyone's a little bit different. And because of that, the stigma is so difficult to deal with, and disclosure is so difficult to make it safe.
Yeah, that's a very important point as well. There's some comments in the chat about kind of reclaiming the word disability and trying to think about, and related to what you're saying, the hurt that people have felt from being called disabled or being called other things related to their condition, and how do we as individuals learn to process that and remove those negative connotations or not. And again, I think it comes back to what we talked about before, that it's each individual person has their own kind of way they view things, and it's okay that everybody has different ways in the language they want to use to describe themselves, the language that they want to use. But that's not to say that it's not important that we don't try and make like these bigger efforts to reframe the language that we use and try to come to a better understanding of that. It looks like we're out of time. There were so many rich questions in the chat that I would have wished that we could have had time to get to, but I really appreciate all of you all, our fantastic panelists, for all of your presentations and for coming back to join us for this really rich and interactive synthesis session. Again, thank you all. And I guess with that, I can hand it over to Dr. Poulos to wrap things up for the day for us.
Thank you, Dr. Sutha, very much. Thank you to our audience. Wow, I can't believe it's over. It went by quite fast. This is the part of the day where we watch our attendance on YouTube dribble off to around 3 people who might accidentally have their stream still on. But please, if you can, stay for a couple extra minutes. I'll try to make it worth your while. My computer, again, is skipping slides. Jiminy Christmas. All right, so first of all, thank you to all of our sponsors and funders who made this day possible. Very much appreciate it. For those of you who have made a donation, thanks so much. And for those of you who haven't, the information, the link to donate is in the chat. Thank you, Katie. Katie, our event planner in chief, is amazing, keeping us organized and on track and realistic, keeping our feet on the ground and allowing us to have big ideas. We very much appreciate you, Katie, and couldn't do this without you. So thank you. Also, I'd like to acknowledge our other supporters, support personnel for the event. Devora Cantor-Katari, who is in charge of communications and social media, Amy Thomas for web and graphic design, Denise Pincombe for administrative support, and Sheila Sanchez for sign language and closed captioning. I'd also like to thank the members of our planning committee, Hannah Arce, Celeste Nguyen, Lizzie Zudot, Ken Sutha, Suchi Rastogi, Zoe Martin Lockhart, Yue Meng, Margaret Govea, Benisha Patel, Lori Leventhal Belfer, Jen Lin, Fatima Mancia, Doug New, Louis Tan, Dakeen Campbell, Amy Bagwadia, Joni Greedhall, and Shayla Katadia. I'd also like to thank my awesome board of directors of SMATI. You'll see that these names repeat somewhat. Me and Ken, Doug, Dakeen, Jody, Shayla, that says voice recognition error, so I should be Shayla Katadia, Suchi, Ellen Zanino, Argavan Salas, Iris Gibbs, Lori Leventhal Belfer, another voice recognition error. You could tell I did this late last night. Michelle Bizo, Terry Adams, Jean-Louis Horn, and our soon-to-be board of directors members not yet voted in because of no quorum at recent meeting, Louis Tan, Sarah Nichols, Amanda Taus, Joe Garner, and Zoe Martin Lockhart. I just wanted to share this picture because I could, and it's fun. Ken and I are like twinsies in this. And the iPhone allows you to like snip out people and put them on a background of your choice. So I thought that was pretty awesome. But sincerely, Ken, thank you so much for being a thought partner and friend in all things SMATI. A plug and an offer of resources to our community for those of you interested in getting more formal and informal mentorship around this topic. We are open for business. disabilitymedmentors.org is our website, and you can email us at info@disabilitymedmentors.org. I want to point you toward the Medical Students with Disability and Chronic Illness National Organization. I'm sure there's a member of MSDCI in the audience who can put their website in the chat, but Google also works. They have a ton of resources on their website for things like disclosure and accommodations and navigating medicine with a disability and chronic illness. They also have build it yourself toolkits for starting chapters at your own medical school or other school. Although it is a group for medical students, they offer their materials freely, and I think that they're widely applicable to any and all groups. For those of you looking for more resources, we have a ton of them. Lisa has a ton of them on her Docs with Disabilities initiative. So I would highly encourage you to check out that website. For those of you with an interest in the medical humanities, just a reminder about the new medical humanities journal that Lily Reed has started. For consideration for volume 1, submissions are due by May 21st, and there's more info on their website. There's a QR code here, which is also on Box, or you can email Lily Reed at rereed@stanford.edu. That's rereed@stanford.edu. And here are their socials. A reminder that we are accredited for 6 hours of continuing medical education, and the information for claiming CME is on our website. If you have questions, you can email stanfordcme@stanford.edu. And once again, just want to show a list of our generous sponsors. And with that, I will offer a toast to my team, to the audience, to our speakers and moderators and translators and captioners. Cheers. We couldn't have done it without you. A wonderful team effort. Thank you so much from the bottom of my heart. Cheers.